Sister Callista Roy. She is a nursing theorist who focused on the central theme that humans are biopsychosocial beings existing within an environment.
So Callista Roy was born in 1939, and she was born in a really wild time in American history. So she was actually born the same year that World War II started. And a lot of changes happened as a result of World War II with women in the workplace. As men were shipped off to war, women started taking on a more progressive role. She grew up in a middle-class family, and she was born and raised and actually got her later education in LA. So her education was pretty straightforward. She got her baccalaureate degree in nursing from Mount St. Mary's College, where she would actually later work as faculty. She earned her master's degree in pediatric nursing and sociology from UCLA, and she actually received a PhD in sociology. So not nursing, but sociology from UCLA as well. So her working life, she came up with the majority of her theories while she was in graduate school, but she also served as a leadership role in a lot of colleges, the primary of which is Mount St. Mary's College. She also was a traveling professor, which is basically where she would travel and give lectures at different universities, primarily in South America and Europe.
The Roy adaptation model was developed in 1976. It was created to promote proper care for a patient by taking a holistic approach, making a nurse looks at all the components of a patient's life that affects their health. The model contains 4 main concepts, and it also defines the goal and expectation of a nurse. It also provides a 6-step process. A person is described as an adaptive system who are growing and developing constantly. It can include an individual, group, or organization. The modes of adaptation: physiological, the maintenance of physical health, example as like the needs of oxygen and nutrition for the body. Self-concept, the maintenance of mind, the self-image, and the outlook on life. Role function in which the patient has in their life. They could be a teacher, student, or a mother. The expectation on how they should behave. Interdependence, self-actualization. Health is a state of process of being and becoming integrated that reflects person and environment. Health and illness can coexist because they are both a part of life. Environment is defined as the condition and circumstances which affects a person or a group development and behavior when the environment is changed. When there's a change in environment, it promotes an adaptive response. It could be negative or positive, and the response requires energy. There are 3 environmental factors: vocal, and it could be internal or external change that promotes the adaptation, contextual behaviors and action that contribute to the stimuli, residual outside factors, which remains unclear and how they affect the behavior. The goal of nursing is the promotion of adaptation for individual and group in each of the 4 adaptive modes, thus contributing to health, quality of life, and dying with dignity. It promotes health and quality of life. It makes plans and nursing interventions, then evaluate outcome. Evaluate the internal and external factors for a patient.
All right, so Roy also founded the 6-step nursing process, which by definition is a method of gathering data, identifying capabilities and needs of humans as an ever-changing system, and how this data can be used in how we approach nursing care. So the first step, step 1, is the assessment of behavior. This is the most intuitive step, and it's the most patient-oriented step. So this includes analyzing and assessing the patient's health history, previous diagnoses, and their observable cognitive behaviors. So in this example, we have a patient, Lana, who's come down with what she believes is a cold, and she goes to her local clinic. So the nurse taking care of her records her vital signs. She asks her some questions about how she's been feeling. She asks her about her health history. And Lana says she has a history of high cholesterol and issues with blood pressure, which also prompts the nurse to take a sample of her blood. So the second step in the nursing process is assessing the stimuli. So within the lens of the patient's adaptive behavior, usually negative adaptive behavior, we look at the impact of both external and internal stimuli. So we talked a little bit before about focal stimuli, contextual, residual. Here they have a slightly different definition. So focal just means the most important stimuli. Contextual is all the stimuli that's not focal stimuli. And then residual is just ambiguous stimuli that we can't put into either one of those categories. So in this example, Lana says she's been feeling tired, that she's been having trouble moving around, and that her blood pressure has been spiking. All right, so step 3 is the nursing diagnosis. So this is a little less patient focused and more data focused. And the nurse is going to gather data relating to the focal stimuli, inform statements about the adaptation status of the patient. So it's really important that these statements are backed up with qualitative and quantitative observations. So now her nurse takes these symptoms in mind and diagnoses Lana with hyperlipidemia, which basically just means you have really high levels of fat in your blood. And then she also believes that Lana is at risk of heart disease. So step 4, this is nurse and patient focused, and it's basically goal setting. In this instance, they set the goal that Lana should take an oral medication, that she should work out at least twice a week, and they recommend that she eats less salty foods and less red meat. All right, so step 5 is where we put those goals to work. So in this instance, Lana starts working out, she eats better, she takes her new medication, and she goes to the doctor's office a month later for a follow-up. So now comes the evaluation. This is the last step. And this is just the nurse kind of self-reflecting on how effective their tactics were. So we compare those goals we set in step 4 with the actual outcomes of these behaviors. So Lana says she's been feeling much less tired in the morning. She has an easier time moving around, and the nurse congratulates Lana and records that her condition has improved. All right, thank you. Any questions?